Ever pondered why those mysterious white marks appear on your nails? Those marks, known as leukonychia, have a variety of possible origins, and today, we're going to delve into some of the most common causes. Firstly, trauma is a frequent culprit. Minor injuries to the nail bed, such as accidentally hitting your finger or constant tapping, can generate these white markings. It's a small sign from your body saying, hey, be a bit more careful with me. Next on the list is mineral deficiencies. A lack of essential nutrients such as zinc, calcium, and iron may result in these white spots. However, this is a relatively uncommon cause, particularly for those who maintain a balanced diet. Another potential cause could be an allergic reaction. Certain chemicals or nail care products might not agree with your body, resulting in these white marks. So always remember to keep an eye on how your nails respond to new products. Fungal infections are also a possible cause. Conditions like onychomycosis can give rise to white or yellow spots that may gradually spread and impact the whole nail. Medical conditions, such as psoriasis, eczema, or alopecia areata, can also affect nail health, leading to the formation of these white spots or other nail abnormalities. Systemic illnesses, including kidney disease or liver cirrhosis, might also influence the appearance of your nails, causing white marks to show up. Lastly, genetics could be the reason. In some cases, white marks on the nails are simply hereditary and lack a specific underlying cause. Interestingly, the location, size, and number of white marks on your nails can often offer clues about the cause. In the majority of cases, these marks are harmless and will vanish as the nail grows out. However, if these markings persist, increase in number, or come with other symptoms, it would be wise to seek advice from a healthcare professional. To wrap up, white marks on your nails can originate from a variety of sources, from minor trauma and mineral deficiencies to systemic diseases and genetic factors. While usually harmless, it's wise to keep an eye on any persistent or multiplying marks and consult a healthcare professional if needed. After all, our nails are more than just a canvas for our favorite nail polishes, they're also windows into our overall health.